dealing with the management of asthma in children, you have four main goals you want to keep in mind during therapy. First is maintaining normal activity levels. You want these children to be able to get the same exercise they would get before, without any ailments like asthma. You also want to assist them in living a normal life. You have them still be a kid, being able to play with their friends, play games, run around, do everything they would normally do. You also want to help the children maintain normal pulmonary function in the lungs. You want to make sure they're getting adequate oxygenation to the lungs and they're strong and healthy like they should be. Lastly, you want to prevent any chronic symptoms or recurrent exacerbations. So you want them to not be coughing all the time like they might be when having an asthma attack. You want them to be able to do everything they normally can. Those are your goals to keep in mind. When actually maintaining the asthma, there are three big things you want to keep in mind. First is allergen control. You want to prevent the exposure to airborne allergens and irritations. There are certain things you want to keep in mind. The common things like house mites, dust, cockroaches is actually something you don't really think about in terms of the allergies. You know they're disgusting, but you don't think of them actually being something you may be allergic to. Mice also are not good. Again, disgusting, but you wouldn't think of allergies. Both these can bring a lot of irritants in the house. You want to keep them out. Dogs, cats, we all love them, but a lot of people are allergic. I myself am allergic to dogs and cats, and even though I've had one my whole life, and I know if the dog lays on my pillow or something, my eyes are going to be itchy the next morning when I wake up. If you can have a dog, you can have a cat, but try to get one with not long fur and try to keep the shedding under control as much as possible. Next is drug therapy. So you got two types. You got long acting and short acting. Put the short acting ones in a short bottle for you. Long acting medications are going to be used to prevent any asthma attacks from occurring at all. Short term are going to be used to stop an attack as it happens. So long-term medications you want to keep in mind and teach the patient about include corticosteroids, chromolein sodium, long-acting B2 agonists. Short-term medications are going to be short-acting B2 agonists, anticholinergics, and systemic corticosteroids. Last thing you want to teach these kids about is exercise. You want to teach them breathing exercises. So you got air going in, air going out. You want to teach them proper ways to breathe, help get the most oxygen into their lungs and out of their lungs. Combining this with lifting weights, exercise, anything that involves physical activity. These two things together will create muscle relaxation and mental relaxation. That's supposed to be a brain. You also want to teach them to improve their posture. Don't want people walking around with their backs like supposed to be more like a curved spine, like almost like a C shape. That's not good. You want their back straight, allows more air into the lungs, and allows them to breathe easier. All these things will also help strengthen respiratory muscles in general. The stronger your respiratory muscles are, the more air you can get in, the easier you will be able to breathe. So those are things you want to keep in mind when managing asthma in children.